Good morning, Franklin Township, and welcome to the January 13th, 2021 edition of the Franklin Reporter and Advocate News Hour. I'm Bill Bowman, and
And
this
I'm
is,
PJ Parker.
yes, and we are co-publishers of, excuse me, the Franklin Reporter and Advocate. Um, we have a really interesting program today. This morning, we're joined by Dr. Perry Halkitis. He is the Dean of the Rutgers School of Public Health. And we're going to be talking about various aspects of the vaccines that are in distribution now, and also the Johnson & Johnson vaccine that is on the horizon. That was the one I couldn't think of yesterday, the name. Excuse me. Before we get going, I just want to remind people that this is being live streamed to our Facebook page and also our YouTube channel. Please subscribe to our YouTube channel. This way there's no risk of you missing anything if you don't happen to be on Facebook at any particular time when we're on. Also, please, as usual, please support our advertisers, and we would really welcome your support in the way of subscriptions to our Franklin Reporter and Advocate news site. And if you are in a position, if you're a business person, please contact us about potentially advertising on our news site and also in our newspaper, the Monthly Digest. We'll get into how we can do that later on. But anyway, we want to get going. I think we have a really good discussion online today, Peach, with Dr. Halkitis. He's studied different vaccines through the years. He studied how they're distributed and the problems in distribution, and I think he's going to add shed some pretty good light on the whole vaccine discussion.
Well, that's I think it's obviously the second topic of the day, and it bears addressing in that I think there's no lack of enthusiasm right now of people actually clamoring to register and be vaccinated. There are still some questions as to the efficacy, the utilization, and more importantly, what are the side effects? It's really too early to have any indication of that yet. So I'd like to have him address that with his experience with vaccines in general, and what his prognosis is for this round to deal with COVID-19.
Absolutely. Let us not waste any more time. Not waste time, but let us not. Boy, it's what, I'm not used to doing this in the morning, and
I know the synapses aren't functioning yet.
At this time of the morning. I'm still like my brain's just like what, and I'm not forming. I'm not doing the word forming thing very well. But without any further ado, that's what I meant to say. Without any further ado, let's bring on Dean Halkitis. Hello, Dean Halkitis. How are you?
Good morning. Good morning, PJ. Good morning, Bill.
Good morning, Doctor.
Thank you for joining us today from my you're not there now, but you represent my alma mater, Rutgers University. I am a proud Livingston College class of '78 graduate.
Wonderful.
Anyway, just so people know who you are, why don't you just give us the elevator pitch of who Perry Halkitis is?
Yeah, so thank you again for having me here. I am a public health psychologist. I am the Dean of the School of Public Health here at Rutgers University. I was at NYU for some 20 years before Rutgers found their ways into my life and brought me here to New Jersey. I crossed over the river. I've been conducting HIV, drug abuse, mental health, behavioral research for some 25 years. And, in the last year, I've really taken all of the lessons of the last 25 and applied them to trying to combat COVID. And I want to say, starting out, that, the lessons of the past often should inform what we're doing right now. As human beings, we don't really remember the lessons of the past, and we repeat the mistakes over and over and over again.
Mm. Yeah, that's interesting that you should say that, because I over the past year I've newspapers.com. I hate to give a plug to no, I don't hate, but I'm not.
Anyway,
newspapers.com is a great resource. I'm telling you, the synapse is just on clicking this morning. Newspapers.com is a great resource for historical research. And I was looking at a lot of newspapers from 1918 era or so. during the flu pandemic, and that back then too, as you say, lessons of the past. Back then too, we had a really large share of very adamant people who did not want to wear masks, and back then they were called mask slackers. And there are stories about fights. I mean, people, tens of people ending up in jail after this mass fight, and they're using the same excuses for not wearing the mask. And the government took a little more, I'm sure the government took a little more stringent approach to it back then, and they actually put people in jail for not wearing masks. But yeah, I agree with you. If we look back at the historical, we look back in history at the last pandemic, and there's a whole lot of parallels to what's going on today.
Yeah, and Bill, I think you do even have to look as far back as 1918. I think you can look at 1981 with the onset of the HIV epidemic, and sort of just think about the first few months of the this COVID-19 pandemic and the panic about the supermarkets and the grocery bags, and go back to the toilets and the doorknobs and all of that chaos that those of us who are old enough to remember from the 1980s was very much there, right? So human beings, react often emotionally and not, with their intelligence and, and their rational minds, and make some bad decisions and often don't make the right decisions for their health. So I'm hoping today during our conversation, we can set the record straight on what the vaccines are all about, and hopefully get our country and our state and our people healthy again.
Absolutely. That's part of our goal. I just have to go back and make a correction. I'm a class of 82 from Livingston, not 78. Like I said, my brain's not working.
We didn't want to age you 4 years, Bill. Okay,
no, it's I'm sure some of my classmates are watching this now, and they're looking and they're saying, "We didn't graduate in '78." So let's do that, Dean Halkitis. Let's talk about this current vaccine. We're now, how far are we now into the distribution of the vaccine? It's weeks, right? Is it months or weeks?
Yeah, it's about a month or so. Like, look, so I've been consistently, here's where we are with the numbers. We've used about a third of the 22 million doses that are out there, which is very bad, right? We should have been using a lot more.
Why is that?
Well, so I think several reasons. Number one, I think that, the federal government just, put the vaccine out there really quickly, and states were not particularly prepared to be able to roll them out in an effective way. That's number one. Number two, who thinks it's a good idea to roll out a vaccine during the holidays? I'm thinking that was not a particularly good idea. Number three, I think, and this is what I've been really talking about a lot and recently, is the phase-in structure is problematic. And I think that I've used this metaphor in the past. Imagine you're on a ship and the ship is sinking. Like we'll think about the Titanic for a second. And we say to people, okay, you have to fill in the first lifeboat first before you can fill in the second lifeboat. For sure, people are going to die as a result of that. So what I want to start thinking about as we continue, and I think this change is happening. We see it in New York City. We see it in New York State. We see it in other regions. We see the federal government trying to push it. We need to be able to stop this notion that everybody in 1A has to do it before we get to 1B, before we get to 1C. I think that people who are willing to take the vaccination should be able to take the vaccination. We have enough stock. I am not worried. Biden-Harris will be around soon enough. And I think that the production will increase and there won't be a problem. The concerns that people have raised, my last point is that if we roll it out right now so quickly, there won't be the second vaccine. Well, I don't really agree with that, given the new administration that's going to be in Washington within a few days' time.
Are you? Let me just understand what you're saying. Are you that if we roll out mass quantities now in order to spread at least the first vaccine round to more people, that is beneficial rather than selectively taking susceptibility groups and then waiting for them to finish their round before finishing or beginning others? Correct.
What I'm saying is that within the 1A group, there are people who've clearly said, healthcare providers who have said, I'm not going to take the vaccine. Well, there's like 30% of folks or 40% of folks. Why are we making people in 1B and C1C wait? So open it up Of course, prioritize those who are most susceptible to the disease and its ravages. But say to like Bill and to PJ and to Perry, you want to take the vaccine? You can have the vaccine as long as we meet the needs of the people who are more vulnerable than you. And that's what I'd like to see.
I think Andrew Cuomo, governor of New York, has already instituted that.
Correct.
That anyone over the age of 65 or 65 and over, or with pre-existing conditions that would predispose them
Correct.
to mortality sooner and quicker. Anyway, I haven't seen that instituted yet in New Jersey, but I think more widespread, and then 3 weeks from now, there'll be another influx of more quantity. Let's get as many people vaccinated as possible.
Right, PJ. I think that, look, we have the Johnson & Johnson vaccine, which is on the horizon, right? So we'll have 3 vaccines. By the way, the Johnson & Johnson vaccine is a 1-dose vaccine, which will make life a lot easier. 1 dose is easier than 2 doses because human beings have a hard time, following up on their behavior. And so, we have the federal government, enact the Production Act, the production, and we should be okay. And I think that, look, I would like this country to be out of this chaos by the summer. It would be amazing if we could do that, to have some sense of normalcy again.
Absolutely. What do you attribute the reluctance of 30% of people in the healthcare field who think would know better? Why are they reluctant to get this vaccine?
Yeah, if human beings were just rational operators, it would be easy. But human beings are not rational operators, and they often make decisions based on emotions and fears. Look, I will say that it makes complete sense to me that members of marginalized populations, like African American population, are more hesitant than white folks because they've been experimented on for years. Think about Tuskegee and what have you. So there's some mistrust, and I think that there's probably a subset, if we do an analysis of those healthcare providers who are hesitant, who are members of the African American population, and as a result have this long history that they have to sort of resolve in their minds, and in their hearts before they take the vaccine. So that's what I think is really happening here. But I will say to you that even my very dear cousin, who is like a master's educated school teacher in New York City, texted me yesterday if she should wait, and my response was no. Because there's also been this sort of proliferation in the media about, is it safe, is it not safe? Let's face it, Bill and PJ, we know that any vaccine is going to have some challenges associated with it. There's going to be some side effects. There are going to be some problems. Nothing is 100% certain. But you know what? For the most part, it's safe, it's effective, and it's the way we're going to contain this disease.
I have been contacted by someone who is involved with well, 2 points. Who's involved with the Somerset County rollout of the vaccine, and who said that there's been issues. There were issues the first few days because you'd have, I'm just going to throw out a number. You'd have 100 people sign up to get the vaccine that day, and 12 would show up.
Mm-hmm.
And so they and this is, I believe this is the Moderna vaccine, and they've got to thaw it out, and they go through all that trouble, and then you can, I guess, from talking to some health folks in Somerset County, you can then put it back in the refrigeration, but it only lasts for a certain period of time. So you've got these vaccines that they thought they were going to be using that the people didn't show up for their appointment that are sitting there. Maybe they'll get used and maybe they won't. That's got to be maddening.
Yeah, it is maddening, Bill.
Wasteful with a resource, that's for sure.
Right. Can you imagine if you wanted to go to your favorite restaurant and it was booked for months and months and months, and on one particular night, half the people showed up for the reservations? It's like, it's not the same thing, but it's just maddening. It's like, it's unfair. It's selfish. And I think one of the themes that I've, sort of played with over the last, year around this disease, which I also did in my HIV work, is like the importance of altruism. What responsibility do we have to our fellow human beings? And quite frankly, if you're going to sign up for your vaccine, sign up for your vaccine. This is why doctors charge us $75 if we don't show up for our medical appointments now, because people have been making appointments and then they don't show up, and it's ridiculous. It's unfair to the rest of us.
Absolutely. We could do an entire program on the death of altruism.
Yeah. Yeah. Unfortunately. Yeah.
The level to which people don't care, I find astounding sometimes, and they're militant about it. And I'm talking about the fact that people, some people don't want to wear masks.
Correct.
Simple little thing. It's a little piece of cloth. You put it on your face, You don't have to wear it 24 hours a day, just when you're around other people. I mean, it's not that big a deal, but good grief, they're up there, and they're shaking their fists and they're screaming about their rights and tyranny and all that nonsense. And give me a break. This is the hill you're going to die on. And literally, this is the hill you're going to die on, that you don't want to put a little piece of cloth on your face. You walk into Macy's in the Bridgewater Commons Mall. Well, maybe not Macy's, but you walk into some stores and you'll see the sign, no shoes, no shirt, no service. There's nobody picketing these stores and claiming that their constitutional rights to be slobs is being abridged, right? But for some reason, these masks and this whole idea of doing something that could be good for somebody else, it's fallen by the wayside, and that's a shame.
Well, it's no longer decorum that's at stake. It's the concept of the safety of the other, and the selfishness of those acts that I don't have to because I don't want to.
Correct.
Well, thank you for considering my feelings and the fact that if you are a carrier, you not wearing a mask could make me sick.
Right.
And I don't want to tolerate that. I shouldn't have to tolerate that. I don't wear the mask because I enjoy it. I wear it because I'm around other people, and it's my responsibility to do my part, as it is everyone's. It's a very, very, very small sacrifice to make.
Yeah, no, PJ, I agree. I think that I love the word "other" is an important word, right? It's because not only do we we don't think about the other, but we other people. We they're different from us, so therefore we don't care about them. We marginalize them. And look, I don't know if you guys are aware, but in 32 states in this country, there are still HIV criminalization laws. So if you do not disclose your HIV status to someone, you could be criminalized. I personally think that those Republican House of people who were in the lockdown, who got the other Representative 6, should be criminalized. Because, if I am intentionally infecting someone, as is the case with HIV criminalization laws, then why doesn't this apply to COVID also? And I will tell you this as a person who has antibodies, who was very fortunate to have a mild version of the disease in March, but still, I walk onto my hallway here and my mask is on.
That's great. Yeah. So you intrigued me a little bit when we were talking before about the history of vaccines. I'm kind of a history nut. So can we go into a little bit about that?
Sure.
How did we even get these things?
Yeah.
Was it to stick a needle in somebody's arm and shoot a chemical in there and say, oh, this is going to work?
Yeah. So it's fascinating, right? So vaccination evolved from variolation, which is originally, and this comes out of efforts in the Ottoman Empire in the 15 and 1600s. And a lot of what we know about vaccines comes from smallpox. Right. So smallpox devastated civilizations for a long time. Not surprising is the fact that the Roman Empire, part of its collapse was due to a smallpox epidemic. It fell apart, structurally and economically. Egypt was bombarded with smallpox. But there's now some evidence that Alexander the Great might have died from smallpox. So this disease has been a plague for a very long time. So in the about 15 to 1600s, the Ottomans and others, but mostly the Ottomans, and I say this with, as a Greek, that with a little bit of tension in my body, actually determined that if you take, blisters from people who have smallpox and you puncture them, you take some of the fluid and you then scrape somebody else's skin and introduce it there, you might be able to introduce the disease, a milder version of the disease, which would then form an immune reaction, which will then sort of quote unquote vaccinate. This word, the word was not called vaccination because it came from the smallpox word, the smallpox Latin word of variola. So this was the first sort of historic, step in the development of vaccination. Eventually, that made its way to Europe and to the UK, where Jenner eventually was able to develop a smallpox vaccine from cowpox, and showed that if you take cowpox and you introduce cowpox into people in small amounts, you can prevent them from getting smallpox. So that is the beginnings of the vaccination phenomenon. And then there was a proliferation of these vaccines throughout the 19th century and certainly the 20th century around various issues, with the most recent of the popular vaccines being the HPV vaccination, which was developed in 2006, which we know is highly related to cervical cancer in women and anal cancer. I mean, I'm pretty sure Farrah Fawcett died because of HPV-related cancer, right? God bless her soul. So I say that with my Charlie's Angels dolls, which are hanging on my wall behind me. So we have the vaccines have been able to contain polio. They've been able to, contain the flu. Each season, there's been this history of really effective vaccination throughout our country. But again, coming back from this original notion, you introduce a little bit of a disease into someone and their body reacts to it and fights it. And then as a result of that, they become immune.
That's actually a homeopathic action as well, on the principle of like treating like.
Yes, correct. Absolutely right. There's like evidence when an immune system reacts. There's some evidence in the HIV world too that when somebody becomes infected, if they have a really huge immune reaction, they get really bad symptoms like the first month or so, that their likelihood of surviving is greater, right? Because it makes sense, right?
More antibodies.
Yeah, absolutely.
Right.
Interesting.
Right. That's interesting.
I
think a lot of the underlying concern about vaccination, I think it's diminished quite a bit since it's become more available. But the concept of introducing the like substance into the body, such as the live coronavirus, I know I myself had a misconception about that until our mayor, Dr. Phil Kramer, made it very clear this is not a live virus. It's a fragment that stimulates the development of that which introduces the antibody formation within the body. Correct. But so that does a lot to dispel some of the apprehension of getting the vaccine.
Correct.
The vaccine itself. What are some of the caveats with getting the vaccine? I'm sure there's still people who are saying, I still don't want to do this. I don't know. It's not proven. I'm hoping it's going to be okay. What are the side effects?
Yeah.
There's really not a whole lot that we can rely on long term in terms of side effects. But what does the study and the science show now?
Right. So look, I mean, the vaccines have gone through the safety trials, the phase trials of the various researchers. So like, nothing is 100% safe. We know that. Nothing is 100% like crossing the street is not even 100% safe, but they are as safe as they can be. And so there is no doubt that some people will get side effects, of course, but people get side effects to the Shingrix vaccine, which is the vaccine for shingles, and to the flu vaccine. But for the most part, no one's going to become deathly ill. There might be some discomfort, but the trials have been very consistent, and the trials are done because they want to ensure the safety. I want to say one more thing to the viewers here, which is this notion that this vaccine was developed in 9 months is nonsense. So consideration about SARS. Remember, we had SARS in 2003 too, right? In the early 2000s. Scientists have been working on SARS issues since that time, right? So there's been this 20-year history of thinking about these types of viruses and what they do. So yes, they were definitely bolstered in the last year because of, COVID-19, but it's not like we haven't been thinking about this for 2 decades at this time. So I want people to feel confident that the scientists have been really doing the grunt work, let's say, over the last 2 decades to figure out how these viruses work and how to contain these viruses. And as a result, we reap the benefits in the last year of now 3 different vaccines available for SARS, CoV-2, or COVID-19.
Well, and that brings me to my question about the differences between the 3 different vaccines that are now available. And is AstraZeneca still on the horizon?
Everything's still on the horizon. I think we're going to have several vaccines by the end of this 2021. They all work slightly differently. They have different mechanics. We know that the first vaccine that was available, the Pfizer vaccine, is 2 doses, 21 days apart. The Moderna vaccine is 2 doses, 28 days apart. Johnson vaccine, is going to be 1 dose. I mean, so they all have slightly different mechanics, but they all use the basic same mechanism, which, as you said very correctly, PJ, not introducing live virus, although that was the case with the original polio vaccine. And part of the problem we had with the original polio vaccine, it was that it was virus that was introduced to the cells and became live. And we had this whole contamination in the beginning, but this is not the case here, right? So that's 1958. Okay, it's 2021. Sure. We've come a long way since that time, right? And so everyone's going to work slightly differently. Every vaccine is going to but to your point, PJ, and to your point, Bill, we don't know if this vaccination is a one-time behavior. We may need it every year, like we get the flu vaccine every year. So we don't know yet. And we're all learning as we go along.
What are the fundamental differences, though, between the vaccines that are now available? And are there choices involved? I see right now the most popular one administered is the Moderna. The Pfizer seems to be falling off in terms of the mass distribution.
The Moderna's one's getting more play, let's say, because it doesn't require the extra cold temperature, right? The storage issue. And, I think as these vaccines become more developed over time, storage issues will be easier. Perhaps dosing will be easier. They will get refined over time. They all seem to be somewhat effective. It's interesting. I was actually talking to a medical colleague the other day who indicated that people like myself, when we get our original vaccine, our first dose may have a much worse reaction than people who have not been exposed to the SARS-CoV-2 virus. And why is that? And that makes total sense, right? Because I have antibodies now. So my body's already immune reacting. So if I bolster the immune reaction, which is what happens with vaccinations, we basically kickstart. I might have symptoms that feel like I'm getting sick. So I want people to not be discouraged if they've had a COVID-19, if they get the vaccination, not to be concerned about the fact that they might have some symptoms. We all might have some symptoms. When I got my first Shingrix shot, for example, symptoms were really bad because I had chickenpox as a child, right? And I felt really sick, for a day. But, the second dose, it was fine.
Another question. Moderna is, let's say, the first vaccine. Have to go back in 3 weeks. Oops, no more Moderna. Can I take a Pfizer vaccine?
Yeah, I don't know if that is, well, first of all, let me just say this. We need to be able to follow the regulations that have been put out by the pharmaceutical companies, right? So I don't love this idea that people don't get a second dose. I think it's okay if it's not 3 weeks, if it's 4 weeks or 5 weeks, as long as you get your second dose, right? Mm-hmm. We say it's better. Second dose is better than no dose. I think there is no clear indications that we should be mixing vaccines. So as a result of that, this is not probably something that's indicated. But finally, I will say this. Well, I'll come back to the point that I made earlier, which is there's a stockpile of vaccine out there. Mm-hmm. Right. I do not imagine right now, given that we've used a third of our doses, that there will be a problem. And more importantly, with the new administration, and I expect rapid deployment in the first 100 days of the Biden-Harris administration, I would not be concerned about this, everyone. I feel very confident that with proper leadership, with proper political leadership, we'll be in very good shape to contain it. But it's a great question, PJ. I would not mix and match.
You would not?
No.
You would not? Okay.
No.
Okay.
It's interesting when you talk about the stockpile. Franklin Township School District was in line to be, I can't think of the designation, but they were going to be a vaccine distribution point for their employees and possibly for employees of local neighboring school districts. December, I think it was December, they announced that they had received state approval and from the DOH, Department of Health, and they were just working out the plans. Yesterday, they came out with an announcement that said, well, not so fast, because the state doesn't have enough vaccine to send out to all these different points of distribution. So even though they had 900 people sign up and 900 employees of the school district sign up and say, yes, I want my vaccine, they're not going to get it that way. And that seems to me it's something on the state level is not firing on all cylinders.
There's a disconnect happening right now between the federal government and the state governments. It's just like, why are we at all shocked at this, right? There was a disconnect at the beginning of the epidemic between the federal government and the state governments. And so, folks, let's just hold our breath for like 7 more days. And things should get better after that. But I do think that, there's been like this, this miscommunication and this misfiring and just saying to states, you have it, but the state's saying we don't have it. Somewhere there's a breakdown in communication here between the federal and state governments, and it's costing people's lives. So hopefully the transparency of Biden-Harris and the openness of Biden-Harris and the belief in science of Biden-Harris will make it easier for every state, blue and red, to be able to contain this disease.
Yeah. I just want to real quick go back to the side effects, because that does concern me, only because something that I read about a week or so ago. I had Lyme disease back in the 90s, and as one of the symptoms of that was Bell's palsy.
Mm-hmm.
Took a dose of Bell's palsy from my doctor, who had been misdiagnosing me for weeks prior to this, to give me the Lyme titer and to say, "Oh, you have Lyme disease." And I read about a week ago where the CDC was having some discussion about should folks who have had Bell's palsy get this vaccine. Have you heard anything about that?
There's been no updates on that. There have definitely been situations documented, a handful of cases where people have experienced symptoms of Bell's palsy as a result of the vaccination. There's been no update. And again, I think, Bill, you take this with caution, right? So I think that, for people who are particularly susceptible to potentially harmful side effects, and that's a very small number of people, Bill, if you're mitigating and you're wearing your masks and, and you're washing your hands and you're staying safe, yes, I'd love for you to get the vaccine, but maybe you just delay it a month or so and just wait for the data to come out, right? So it's a decisional balance exercise here for you, because I would hate for you to have a negative reaction to it. But, we'll know by April, May, June how this thing is working as more and more people get it. But stay home. That's what for those of us who have been fortunate, which is, not many Americans have been able to stay home and stay safe. I will say that I think it is imperative that we get this vaccine to our frontline workers besides our healthcare providers. Our school teachers, our UPS drivers, our mail people. People who are working in supermarkets, the people who are working in restaurants. Come on, folks. The doctors are great and we love them, but really these other folks, often of less socioeconomic means, often living in multi-generational homes, often in crowded spaces, are even more susceptible to the disease. So let's use a little social justice framework here in thinking about how we roll this out.
Yeah. Let's talk about that a little bit. You mentioned that earlier. I forget if it was online or offline. About the prevalence of folks who are living in a bunch of people in one apartment, opposed to folks who might live in an estate.
Right.
And the differences in how they're catching this thing. Yeah.
Look, I'm going to start this answer to you, Bill and PJ, by saying, as a white man who has a lot of privilege, I understand, the benefits that are bestowed upon me and the bestowed upon me by this society. I was saying to Bill before we got together online live, is I on the weekends, my husband lives in New York City. I go back to New York City in the financial district where we live, and there's hardly any cases there. Well, yeah, because everybody escaped to their country homes. Right. But everybody doesn't have country homes like upstate or at the beach or something like that. So what we're seeing is that, not surprising, where you see poverty, where you see crime, where you see racism, where you see discrimination, you see disease. Those things just don't happen automatically. People don't wake up and say, "Oh, I think I should have a heroin addiction, or I should get COVID-19." Life circumstances gets them there. And this is true for COVID-19. Why anybody was shocked that Black and brown people were getting infected at higher rates and dying at higher rates is beyond me. Because if you look at any other disease in this country, it's the same exact patterns here. And it's because social conditions and structural barriers affect disease. And I just, for the life of me, after like 30 years of doing this work around HIV, don't understand why the medical profession doesn't get this, that, you know, that social conditions fuel health disparities. And we're not doing a particularly good job in that regard. So, you know, I've had conversations, you guys, with people around, you know, with physicians who've like said, well, why don't those HIV positive people take their medications every day? And my response is, well, because she's a mother and she has no health care and she has like 2 jobs and 4 kids and no support, like taking her pills every single day is not necessarily a priority for her. And so until we create a situation where, you know, social justice sort of prevails and where we have like an less economic disparity, we're going to continue to see the differentiation that we see here around disease and disparities. So I want to stop talking about health disparities, because that means that they're different, and start talking about health equity. Because health disparities means there are differences, and health equity means like, what are we going to do to actually affect those differences? And, you know, I think that starts with combining the efforts of academicians and practitioners and governments and industry who know perfect, like, why isn't like, you know, Audible doing like programming and the messaging around the vaccine? Because they know how to do this really, really well, right? In a way that the departments of health do not know well. So you bring those 4 entities together and you potentially affect a change in people's health around messaging and about behavior and about psychological states that fuel behavior that I think are really important.
So you seem to have thought this out. Obviously, this is what you do. So Joe Biden's office gives you a call on January 21st and says, Dr. Halkitis, I want you to be the lead of my distribution effort for the country. What's your plan?
Oh my God, I wish he would call me and ask me that. I'd go in there, like I would be there in a minute. Okay, so my plan is the first thing I do is very, very quickly take stock of where things are. Who's got the vaccine, where we are, what are the populations that have gotten it, what are the populations that have not gotten it. Number 2, we do as has been planned by Biden and Harris, who release all the vaccine. Number 3, I ask each of the states to give me a plan about how they're going to undo their phasing and, you know, actually make it available. I want to, step 4, ask each of the states to also tell me how they're going to do vaccination fairs. Have you guys seen the video of like the vaccination fairs for polio? They're like fascinating to me. So in the 1950s, you know, they had these big fairs where people would come and get their polio vaccination. Now, a little more complicated with this disease because it's so easily communicable, but still we can do fairs around that. So I want to build that kind of programming. And I've said on many occasions, I want there to be a fair, like at the Meadowlands or at, you know, City Field or wherever you want it, where we have distancing, where we provide the vaccination, where we also, by the way, do blood pressure screening and we weigh people. And by the way, there's a little music and fun music in the background to make people calm, and we make it an event. And why do I say that? I was in Taiwan. The last trip I took was in September of 2019, and it was in Taiwan. And I went to this very small town in Taiwan where they had a public health day, where it was exactly that, where people were getting guidance on how to quit smoking and how to control their blood pressure. And that kind of holistic, every disease, you know, dealing with the whole person together in a group setting where we normalize that kind of thing is exactly what I want, how I envision health moving forward in this country. That's what I would do. Joe Biden, call me, please.
And just when you said that it's particular unto this country, I try to be as holistic as possible, and I'm very familiar with ozone therapy, which is not prevalent in this country. Whereas in Canada and Europe, there are ozone bars that you can just avail yourself of that, and ozone is very effective in dealing with malignancies, in the fact that oxygen does not permit a cancer cell to survive.
Right.
So that it's not a more widely practiced modality. And what this has to do with COVID, I'm not sure, but it was more the principle of there is so much that is available and considered mainstream outside of this country. Right. And I'd love the idea of a health fair that also includes preventive as well as diagnostic and treatment and the availability to administer a vaccine as required or as needed.
Yeah, I know. I love that idea too, PJ. And look, I have a holistic approach to health too, right? So first of all, can we just say mental health? Stop using the term mental health and just say health. Like, why do we have to separate mental health and physical health? Like, depression is health. Anxiety is health. It's not lesser than cancer. It's potentially it's more prevalent, more problematic. But I love this idea of like, how do we teach people meditation? Like, I have an app on my phone where, every day at noon, it's called Buddhify. I sit and I meditate for 15 or 30 minutes, right? And it is what centers me and gets my stomach calm, right? And it's like a very big part of my health-seeking behavior, as much as any vaccination or weight loss program or high blood pressure medication that I'm on. It is as critical to my well-being as all the rest of that stuff.
Is that an Apple app?
Yeah. Yes, I have an Apple phone. Correct. Yes, it's called Buddhify. I really love it. I discovered it 3 years ago, and let me tell you, I'm like an A-list personality guy from New York City, right? So I need that app like you cannot believe.
I can relate.
Given your research over the past several decades, I can imagine, and I was just sort of, this thought's been germinating in my head since we've been talking. I can imagine.
Excuse me just for a moment, gentlemen.
Oh, sure. I can imagine that back in January, February or so, March, flags must have been going up for you, right? I mean, you must have seen so many parallels between the beginnings of this COVID pandemic and the start of the AIDS crisis.
Yeah, it's a great question, Bill. I actually just wrote an article about it that appeared in the Journal of Public Health Management about the similarities between the disease. I think it did a couple of things for me, right? I think I was able to dive into this area because of that 25 years of work around HIV. But I will tell you this. My first reaction was to be re-traumatized, right? Because I think anyone who's lived through one pandemic, all of a sudden you have another pandemic and all of that stuff gets stirred up again. But at the same time, I'm reminded by my colleague, Dr. Kristen Krause, who was one of my first doctoral student who graduated from Rutgers recently, that out of that came a resilience also, right? Which was like, I lived through that chaos of the 80s and 90s, and I developed a skill set and an armor of sorts to be able to manage this effectively. So, AIDS was a disaster and it was horrific, but you got to see a silver lining in everything too. And the silver lining is it gave me these tools to be able to fight this disease. But it did, it raised so many flags and it triggered so many emotions. It was incredible.
Sure. I mean, just the parallel, just the willful, I had the word in my head, it popped out, but just the willful ignoring.
Yeah, the disregard, right?
Disregard, that's the word. At the very beginning, I mean, with what Reagan did and with what Trump has done, I mean, it's amazing.
Which is, and the question for me is, and this, I explored this in the article, like, which is worse, right? It's like, so you've got this, Reagan's a god now, I understand, right? I get it, right? It didn't seem like that in the 80s, but all right, we'll go with it. He doesn't say a word about HIV, because it affects the gay population, all right, and he doesn't do anything about it, and that's negligent on his part. But this guy, in the last 9 months, the last year, I actually think has precipitated the epidemic by denying science. If he at least had been silent, right, he wouldn't have created such, a doubt, right, in all of our minds, so that my cousin even calls me. My very educated cousin called me and asked me to take the vaccine. That's the result of Donald Trump, doubting science, that's evident. And quite frankly, here's my call out to the educators of our country. Reading and math are important. Can we focus on social studies and science? Because I think what we've learned from this epidemic is and this political turmoil is that people don't know how the government works and people don't know how viruses work, right? So can we infuse that into our curricula a little bit more?
Right. Well, I think my opinion, I mean, we were all much younger back then, but back then with Reagan and the AIDS thing, it was more bigotry, right? It was more homophobia. I think with Trump, and he has said this, I mean, the famous comment he made about that cruise ship, I think out in California, where he didn't want them. It was, I don't know what percentage of, had been infected with the virus. They were still on the ship. He didn't want them to come to offload in California because he said that will bring our numbers up.
Yep.
And that's what he was concerned about, right? He was
Right.
concerned about how bad it would make him look and what effect it would have on his reelection. It was all
Well, right.
I think with Reagan, it was a little more sinister.
Yeah, no, I think for Reagan, it was, look, I mean, it was homophobia. With Trump, it's anti-intellectualism, anti-science, which is like a different kind of like discrimination. And he didn't want the numbers to get screwed up, just like he didn't want people to vote by mail.
Right.
Because why? Because you don't want people to vote.
Yeah.
What's wrong with? And it's like somehow voting by mail became bad. Like, why don't we want people to vote? Like I wish every American voted. I mean, I almost wish you would get a fine if you didn't vote.
Yeah.
Right? You're right. So that we wouldn't have to have this conversation anymore. But that's, he doesn't want the numbers to look bad for him. And here we are today on January 13th.
Right. Hoping that maybe by the summertime things will get better.
I've said June all along. I've been saying June. I really do think that's where we begin to turn the corner. And I do. Why do I say that? If Trump had been reelected, I would not be saying that. But I do really think that they're going to Project Warp Speed, which by the way has turned into Project Snail's Pace now, with the distribution. I think that that Biden and Harris are going to really rev this thing. It's going to be to get their full attention for the first few months, and it's going to get us to a much better place by the summer. Because I would like there to be an Olympics this summer. I really would. I love the Olympics, and I would like that to happen. So that's my personal plea to Joe Biden. Please.
We are seeing a resurgence of some activities. I know the Tour de Franklin Food Bank race is going to be rescheduled, so that's
Slowly.
We're kind of creeping back
Yeah,
little
we're
by
getting
little.
baby steps.
Yeah,
Baby steps.
that's a good thing.
We're going to have to rethink things in general. I mean, I don't know if we ever go back to normal. I mean, maybe like in the future when we go to our concerts and we go to our ball games and that we're always going to have our temperature checked. Who knows? I mean, maybe that should become a normal thing right now. I don't mind. Like, I will be honest with you guys. I have been going consistently to the gym. I think the gym is actually pretty safe. Right? I don't mind going in and wearing my mask and having my temperature taken as I walk in. What's the problem with that? So I think that we have to rethink. It's not going to ever look like it looked in 2019.
Of course. Now, following up on that concept, I've been talking with a few people about something I heard I keep saying Mario. Andrew Cuomo.
Mario.
Yes, I know. Native New Yorker roots showing. He had a proposal. I'm not a football fan, so that I'm not exactly up on the scheduling. The game may have happened already, but it was the Buffalo Bills playoff in a 50,000 seat stadium where 6,700 people had been invited to attend as fans, observing social distancing, masking. But the new norm was that prior to entering, you were going to be tested with a rapid test.
Mm-hmm.
Not only your temperature, but a rapid test. And right then and there, the results were you have it or you don't have it, go home if you do have it. And then the follow-up with the contact tracing mechanism also in place. And I just think that I'm sure, because I'm Pollyanna sometimes in my concepts, that this has broad-based range potential for opening other venues, other restaurants. I know
Agree.
hat I wear is that I'm in the music business, and that has been devastated by venues closing, by concerts closing, Broadway is shut down. That it has the idea of expanding a quick turnaround test, like now rapid testing, and that has to give us a modicum of safety to be able to resume on even a small level, to get the economy back to something where we can function again. What's your thought about that?
I'm 100% on board with that idea. I think, look, the rapid tests are not as accurate as the PCRs, but they will become more accurate over time. But I'll take 70% accurate over not testing people at all. I think I can live with that probability. And I think there has been consideration about that. At Rutgers, people who are coming to the offices must test every week now. So it is a way of containing the virus. So I'm with you, PJ. I want concerts back, right? I need to, I hate to admit this, but I'm going to admit it to the two of you. I really need to see Taylor Swift now after these last two albums. Because these last two albums have been phenomenal. Okay. And it's like, okay, I would never say that before, but now I'm going to say, but like, yes, have an antigen test, right? And sure, is there a 30% chance we might miss somebody? Sure. But there's a 70% chance we're going to get it right, and those people will be turned away. And I think in the absence of really containing this disease, it's a really, really effective and smart way to open things up again. Absolutely, absolutely right.
It's a start.
It's absolutely a start.
Yes,
Right.
and combined with vaccination, that they're in these little baby steps for effectiveness, for detection and further prevention. That I think I love the idea. I'm sure that it's flawed, which is why I brought it up to you. But I still think it has the, rather than say the word germ, but it has the kernel of possibility to really be effective.
I mean, PJ, you're bringing up an idea that's been floated around for a while, and it's not flawed. It's actually a stellar idea, and it's like you want this notion that somehow economic health and public health are separate is nonsense, right?
No,
You want
begets economy.
Right, we got these things have to like inform each other, and yeah, that's the way we're going to open, Forno's down the block from me here, which is like my favorite restaurant here in Newark, right? It's like test people at the door. Right, you come in 20 minutes before, you're right, you have your test, and then you wait to see if you can come into the restaurant. That seems fair. Seems great, actually.
Yeah, that's it. I think it's really got potential. I don't know how it can start to be effected other than many more available rapid testing mechanisms. Right.
Well, and even better ones, but they are. I mean, it's the technology's there. I mean, look, have we learned? One of the things we actually have learned from the last year is also like, oh my God, everything is here. Like if we want it to be, right? It's amazing to me. Like our school, one of the benefits of being a New Yorker, and one of the horrible things about being a New Yorker, is that I saw the Twin Towers fall on 9/11 from my apartment, right? So, talk about trauma. But I will tell you that as I saw this epidemic come, and as a result, I was at NYU at the time, as a result of that, we had to really muster to put everything online and be really, really effective in the teaching of our programs. And as I was seeing this disease roll out, and in February, I was like, I said to my faculty, we got to be ready to roll online because this does not look good. And boom, with one switch, the school continued to function. And I think technology is there, the manufacturing ability is there. Trump hasn't called the manufacturers to do their work, but Biden-Harris will. And you can do these tests. I'm sure you can make them really cheap very soon, and restaurants can buy them. And you want to go out and eat, here's your antigen test. Take it now.
Exactly. It becomes a new norm for everyone's safety.
Like washing, I will say to you guys, I was always okay with washing hands. I'm great at it now.
You sing the happy birthday song to yourself as you do.
I have my little COVID station with my antiseptic and everything. It's just we are changing the rules of life a little bit here, and that's all right. That's all right.
Yeah, I want to go back to something you said before. You said that you questioned whether we would ever go back to 2019 normal. I don't know how normal 2019 was, but historically, after and I go back to the flu pandemic because that's the really big one. Did things change from 1917 to 1919, 1920? Did people not do things after that pandemic that they had been doing prior?
I mean, there was all this social change in the 1920s anyway taking place. There was a much more egalitarian approach to society that resulted that people say that World War I was one of the incentives for the egalitarian society. But I actually think the 1918 pandemic was also, because it showed that everybody was vulnerable. No, but what it did, I can't answer that directly, but what I do know is that there was this huge proliferation of vaccine development after that, and so nothing. I've said this in my research. The minute you ask a person a question about their behavior, they're never going to be the same again because you ask them a question. There's no way anybody lives through this or lived through AIDS or lived through that who's going to be the same as before. So it does individual change, which ultimately affects societal change. The public health crisis of the AIDS epidemic in the 1980s and the development of ACT UP changed the way pharmaceutical companies worked, changed the way that patients had a voice in their care, really provided the social justice, health equity lens of public health, which defines how public health is thought about right now. So yeah, this is a booster to that. It's going to change things.
Is ACT UP still around?
Yeah, ACT UP is still around. In fact, they have a whole COVID group now that is really good. Look, I mean, it's like the active, like, you know, those guys are my age now. We're all like older, right? You know, but, you know, there's lessons from the past that, you know, inform the work that we're doing now. And, you know, I was tangentially involved with ACT UP at the time, but, you know, those men and women, you know, those people who like gathered in those rooms and demanded that the pharmaceutical companies be open and honest and develop the medications, transformed the way that these companies worked. And I think we're reaping the benefits of ACT UP right now.
Wow, interesting. I want you to put your psychologist hat on for a second and talk about two different things. You know, people seeing needles. Even our doctor, our mayor, yeah, right, who's a neurologist, and he even said to me, you know, they have to drag me. He said, but for this shot, I want to get it. I'm willing. I'm happy. We did a live stream. I think it was last week of him getting his COVID shot at in a hospital in Perth Amboy. So. What goes on in people's heads, you know, with these needles? Is it just the fear of getting stuck by something?
Yeah, the wound, the distrust, the pain. You know, people don't like pain. People have mistrust of, you know, the medical system. They're afraid of the wound as something, just like people are afraid of snakes. It's like this cultural phenomenon. Snakes, rats, you know, we've like developed this mythology around it. But what I think will happen is like what happened with the polio vaccine too. You guys should remember this. Eventually, I remember getting it on a sugar cube, right? Eventually, when the non-live version of the polio vaccine was available, and it was on a sugar cube that the school nurses did in schools. We'll have potentially that maybe, I don't know, with 100% certainty it will be on sugar cube. But I do think it's like people's anxiety about the medicalization anyway. We need to, and this gets back to your other point, Bill, and it gets to the fair question. We want people to take the vaccine. We can't expect people to come to us. We must go to them. When I was doing my HIV work as a young guy back in the 90s, early 90s, what did we do? We took testing to the bars, to the clubs. Right? We just didn't expect people were going to come and be tested. So we have to reduce the barriers, right? Make it easy. You'll get the fear down, like the little music at the fair, right? The little like blood. We're gonna do your blood pressure and teach you how to meditate. And while I'm talking to you about meditation, boom, I'm gonna stick you with this needle. You won't even know what's going on. That's the holistic thing that PJ was talking about, right? The whole person.
Which is exactly what happened with Mayor Kramer. He was discussing some level of vaccination, and all of a sudden he had it. The nurse worked very, very quickly as he was talking, took full advantage of his distraction, and it was fine. But right. Even he, who is in the medical profession, had it was trepidation. No, you're going to stick me. Oh, no.
Right. It's like you see it with children when they're with their pediatrician. It's like, you know, the doctor's behind there and the mom or the dad or whoever is like, oh, look at the fuzzy bear. Boom. Done.
Right. Exactly.
Right.
It's the distraction.
I have a story that I've been telling a lot about that as a kid. My dad was in the Army. I was born in a military hospital, and I don't know how old I was. It must have been maybe 4 or 5. And I had to go in for some shots. I did not like shots. I was scared because after I got the shot, I would keep my arm stiff. So therefore my arm would stiffen up. And I always equated the stiff arm and the painful arm to the shot. And I didn't want that. I didn't realize if I just moved my arm around, it would go away. So when my mom took me to the hospital, and this was back, you know, they had the waiting room and they had those plastic chairs, you know, like the red and blue plastic chairs on the metal frame. All lined up in the waiting room. And then you go to the little room to get your shot. So my name gets called and we walk in. And I see that needle. I'm like, I noped out of there, man. I ran out of the door. I will never forget this. I ran out of the office into the waiting room. There's people in the waiting room. I'm jumping over chairs. I'm going under chairs. It was like a little rascals routine I've got doctors and nurses chasing after me in this waiting room. And I'm just, doing all sorts of gymnastics. And they finally got me. And it took 2 people holding down my legs. It took 2 more people holding my shoulders down.
Right.
Before I
Wow.
got that shot. And
Because
my mother was absolutely mortified. I was just like hysterical. It hasn't been that bad since, actually. But yeah, that was quite the day.
because fear is learned, right? So I always come back to the story of baby Albert, which was a study that was done by a psychologist named Watson in the early 1900s, where what happened was that there was a baby, and they would put a piece of fur next to it, and every time the baby would touch the fur, they would make these big loud sounds go off. Eventually, because they did it enough times, the baby was afraid of fur, and eventually the baby, even when you put a cat or a dog in front of it, was afraid of a cat or a dog. So fear is learned, so it can be unlearned. Yeah, conditioning, correct.
What a horrible thing to do to a baby.
I know. Well, it's before we had, institutional review boards, that prevented U+ from sticking people with syphilis and not treating them for like years. That stuff happened, and fortunately, it does not happen anymore. But the effects of those events and those actions are still with us.
Well, Dr. Halkitis, is there anything that we have touched on or is there anything we haven't touched on that you feel might be important for people to know about vaccines?
I mean, I think that I will say something with my psychologist hat on it, which is this: wearing a mask, washing your hands, getting a vaccine is just the right thing to do for you and the people that you love. And I'll come back to the story I've been saying for a year. The reason I have lots of motivations to enact health behaviors, but one of them is my brother who has MS. The last thing I want is for my brother who has MS to get this disease and perish. And so if you don't do it for yourself, do it for the person you love the most, or one of the people you love most in the world.
Exactly.
Well said. Well said.
Yes, that this is a point that I keep making as well. The vaccine is not the end of your responsibility to others. It's the responsibility unto yourself. It's your benefit for you, but the mask and the social distancing is for those around you.
Correct.
It's a combined effort, and we cannot get complacent now. We just can't.
No.
We have to continue with the mask, the social distancing, the hand washing, and keeping things clean, and doing the right thing. And
Yeah.
the vaccine seems to be the last leg of this journey, but the others are going to be continued. This is going to be a norm for quite a long time.
And this is
It's going
not
to be
the
very hard, personally, for me to go someplace in public and not wear a mask.
Yeah, we all have this underlying trauma from all of this. There's no doubt about it. And let's remember, public health and epidemiologists would tell you that the 1900s were really effective in eradicating infectious disease. But what we've seen over the last 40 years is infectious diseases are back. Ebola, HIV, this is just the beginning, everyone. Right. So it's COVID-19 right now. It's going to be something else really soon. So these health behaviors are always going to be important to our lives.
The vaccine, just to backtrack a little bit, does this particular strain of vaccines, I mean, from Moderna, AstraZeneca, Pfizer, Johnson & Johnson, do they also act for any other SARS derivatives? Is this only unto COVID? I mean, would it protect on any other
Interesting
level?
question. It may. I mean, the science behind it certainly will work. I mean, it seems to be clear that the vaccines work with this variant. And by the way, why are we surprised there's a variant? Every virus mutates. There's always variants of every disease, right? It's not a shock. That's why we have a new flu vaccine every year, right? Because it changes. And so people relax. This happens normally. But it will, PJ, if it doesn't solve the other potential SARS diseases in the future, it at least provides the infrastructure for developing it.
Mm-hmm. Does it also protect against the flu virus?
I don't think so.
I guess what I'm saying is someone who is predisposed to getting a flu vaccine, is that redundant on top of the COVID vaccine?
No, I have a flu vaccine, and I'm going to
take a separate flu vaccine on top of the COVID vaccine.
So I think one day in our lives, we'll be able to go to the pharmacy and there'll be one needle with all of those things in it, and they'll just poke us with that, right? And so, yeah, no. Look, I mean, if there's any lesson here, it's like you must have your flu vaccine, you must have your SARS vaccine, you must get your shingles vaccine. This notion that vaccines cause harm and autism, that's false. It's false. We all know that's fake science. It's fake. I don't want to say fake news, but it's just fake science. And so we have to trust the science. Just look at the quality of life and the longevity of life that has resulted because of vaccinations and because of public health approaches over the last 100 years. Because I assure you, my friends, 100 years ago or 200 years ago, we would have been dead at, I don't know, 40 or 50. And here I am at 58, ready to go for another 30 or 40 years.
Good. We need you.
I wanted to get a quick question in here. Karen Smith asks if somebody on chemo should get the COVID vaccine.
Yeah, so this is going to be a decision, Karen, that you have to make with your doctor. But you put somebody on chemo is potentially immunocompromised and probably would benefit from a vaccination. I would imagine your doctor would say yes, but that is a decision you have to make with your doctor. We know the amazing Bonnie Watson Coleman, who has been dealing with cancer for a long time, is vaccinated herself, and probably is hopefully what is going to keep her healthy after being exposed in that bunker at the Capitol.
Right.
Yes.
Also, Shital Patel had this question for a while ago. I don't know if you know the answer for this, but apparently they registered their parents on the website for the vaccine. Should they register on the county website? I'm not aware of a county website.
No, Shital, the New Jersey website is actually really good, the pre-registration site. It's actually very easy to navigate. I think you're set. I've been getting, updates from that because I registered for it too. So I think you're all set.
All right.
Are there any other contraindications? Do not take this vaccine if.
Some forms of there are some people have some allergic reactions to it. I can't remember off the top of my head what it is right now, but this is why they watch us for 15 minutes after we've been vaccinated.
Mm-hmm.
So folks, but I can't remember right now what it is, but there are some. Just like if you have sort of like they ask you with the flu vaccine, if you've ever had an allergic reaction or if you're allergic to eggs and things like that, there are a set of these criteria that you can probably find very easily on the website that indicate what allergies potentially will cause you to have a very negative reaction. I can't remember them off the top of my head.
Mm-hmm.
But yes,
there is really no fundamental difference between the 4 choices of vaccines that are out there right now.
I mean, they all seem to work. I mean, every year there are different flu vaccines out there too, right? Mm-hmm. So it's like, take your choice, take the one that's going to work best for your lifestyle. I personally would prefer the 1-doser myself because, it's just easier to go once than twice. But if I have to get the 2-doser, I will. At this point, let's just get as many people vaccinated with whatever. The science will bear out in the next year or so to determine, which of these are ultimately most effective. People are doing these studies right now. We'll know a year from now which are most effective, and people are, which ones are going to need a booster, what have you. But for now, just go and get what they give you.
Mm-hmm. All right. Wear your mask, wash your hands, get tested.
Social distance, all that stuff.
Yes.
Get tested. Testing is essential.
Absolutely.
Yes.
Absolutely. Dr. Perry Halkitis, thank you so much for
coming. Thank you.
It was a pleasure meeting you. Please do come back. I'm sure over the course of time we'll have other discussions about health issues in the state and the region and whatnot. We would love for you to come back on and talk to us again.
Thank you for the opportunity. It was great. I appreciate it.
Really appreciate your knowledge.
Absolutely. Joe Biden, call him.
Call me, Joe. Call me. All right. Bye-bye.
All right. Thank you.
Thank you. I love when we have really, really, really intelligent people on and who are really well spoken.
Well, he certainly has a breadth of experience and background with the contagious illnesses and stemming them.
So that gave me some pause for thought, having had Bell's palsy. I was leaning toward, I mean, who knows when I'd be eligible for it anyway, but I was leaning toward holding off a while to see what the
evidence, yeah, or
evidence
the
is.
incidents.
I don't want to ever go through that again. That was horrible.
Oh, it's a paralysis.
It scared the hell out of me. I thought I was having
Sure.
a stroke. I really
Not
did.
knowing if you've had a stroke or not.
35.
Exactly.
I was at the time. I mean, geez.
I know. It's very scary.
I wonder what comments I made today that would tick off some of our fans. I can't wait to find out.
Well, I think our mission is to bring the news as it's out there and to keep lines of communication open for the benefit of this community. And people are going to have their opinions no matter what we chat about.
Yeah.
So that's why there's vanilla and chocolate.
Absolutely.
But anyway, I was very happy to have him on. At some point, I'd like to talk with him about some of his charitable work and see if we can conjoin forces for something like that as well. But yeah, it was an interesting discussion. The vaccine is going to become part of the norm, just like the masking and the social distancing. And my only fear is that it's going to be perceived as, okay, that's all I have to do now. I don't have to wear a mask. I don't have to be careful where I go. And, oh, so what if I forgot my sanitizer? No, it's all part of the process.
Well,
And, I hope everyone takes away that concept. It's part of the process. It was the missing link. We had the masking. We had the distancing. We were cautioned all the time to be very careful about being clean, keeping our surfaces clean. Now the final step in this is the protection of the self, as well as the protection of others. So it's looking promising, and if people just do what's available and have a little watch puppy to alert you to the facts, we should be okay.
People say, I mean, they've been saying from the get-go that getting the vaccine won't necessarily stop you from getting the virus, but it will lessen the symptoms. So you won't get, you could still get sick. You're just not going to get as sick. But the point is, you still could get sick, which means you could still pass it on. So you still have.
That's also very true. And although the wearing of the mask and the distancing is protective of the other, when the other is wearing the mask and social distancing, the protection extends back to you. So it is a community effort. This is way beyond Franklin, but our community is Franklin. We have to still do these things for ourselves and for others. That's at the heart of our humanity. If it isn't, who are we?
Yeah, well, our humanity has taken a hit over the past.
That's the subject for another Franklin Reporter and Advocate News Hour.
That's for sure. We are not.
Speaking of which, this coming Thursday, that's the 14th. Which is that tomorrow? Oh my gosh, that's tomorrow. Is today Wednesday? I'm losing my mind. Anyway, it's January 14th, which is Thursday, which I do believe is tomorrow. Our special guest for our news hour at 7 p.m. will be Dr. Alex Karazi, who heads the Franklin Township, Somerset County Interfaith Council, as well as Captain Sean Hebben, who is one of Franklin's finest and who are both involved in years past in the Martin Luther King breakfast that this year is going to be a virtual event. We wanted to bring them on so they could be discussing the scholarship effort that has always been a keystone of the breakfast and community giving, that it propels youngsters into different levels of their education possibilities through the scholarship event. And they're going to be discussing that and its significance, how students are selected, how you can donate and keep these dreams alive in the name and in the tenets of Martin Luther King. So that is tomorrow night at 7 p.m. right here, Franklin Reporter and Advocate News Hour. We also have started to offer sponsorships if you want to take advantage as an advertiser of your business or your social concern. You can contact me, PJ Parker, And my email is ads@franklinreporter.com. We typically get a lot of viewers to be hearing your message. So more details, I'll give you another phone number as well, 732-820-0840, and we can chat about that. But not to take away from the event itself, it is tomorrow night. Martin Luther King discussion about the scholarship with Captain Sean Heaven and Dr. Alex Karazi. So I didn't want to end this broadcast without mentioning that. You will be seeing more information of it during the course of the day.
Yeah, and no, that's good because we've supported that group for a long time. So they do good work. It's in a good name. I also wanted to circle back to something you brought up earlier about the Tour de Franklin. Got the news yesterday that they are coming back in April, and it's going to be a little bit modified, but they're going to have the road. It's not a race, but the road. I guess the tour. It's a tour in April, and this is a major fundraiser for the Franklin Food Bank.
Well, you might want to mention what kind of a tour it is.
Well, it's a bicycle tour, and you can walk it. They have routes. They have smaller routes, and I think in Colonial Park that you can walk. But it's a bicycle tour, and it takes you all throughout the township. I've ridden it myself. That's a strange construction of a sentence, isn't it? I've ridden it myself. I've ridden it. Gosh.
Anyway.
6 or 7 years. I'm still not awake. 6 or 7 years, and it's always fun. They always throw a little for the longer route, which in the past I believe there's been 62.5 miles, which is a metric century. They've always thrown a little bit of challenge in there in terms of climbs, and there's some pretty decent climbs in this township, Franklin. If you're not a rider, if you're just driving around in your car, you can tell if you go up certain roads. And it's a lung buster, but this is a great ride. It's a great time. You meet a lot of interesting and fun people, and it's for a really, really good cause, which of course is the Franklin Food Bank and helping our neighbors who are in need. The food bank took a really big hit last year because of the COVID pandemic. They were not able to do their major fundraisers, one of which is the Tour de France. Well, they did the tour, but it was a virtual tour. Mm-hmm. And they didn't have their bowl. What's that called? Empty bowls.
The Empty Bowls promotion, right.
Has become another big fundraiser. Right. They weren't able to do that to the full extent that they have. They weren't able to do several other things that they normally do during the course of the year. So it's good to see that at least this first event's coming back, and this really has been for the past number of years the first for people like me who do these road challenge things, the first event of the season. So it's always a nice little warm up. Mm-hmm. What comes? I've done charity rides of 100 miles and such, but so that's fun. I don't know what else was I going to say. I don't remember. Anyway, yeah. So that's that. So if you want to check out what's happening in town in Franklin Township, you can always go to www.franklinreporter.com, which is the Franklin Reporter and Advocates website, and we bring you what we consider to be the most thorough report of news that's going on in Franklin Township. Mm-hmm. If you have tips or complaints, we've had a few of those lately, you can email me. That's the wrong one. You can email me at editor@franklinreporter.com. If you'd like to advertise with us, again, the way to contact PJ is ads@franklinreporter.com. You can find us on Facebook, which is where you're probably watching this right now. We're also on Instagram, and we have a Twitter feed as well. So there you have it. Anything else to say, PJ?
So we're everywhere, Franklin, and from the beginning, the mission has always been to bring Franklin to Franklin, and not just the sensational, not just the bad news that was popular to sell other media. We came from other media. We know what was out there, and we know the reputation that Franklin had in years past. And one of our very basic promises when we started this was that we were going to highlight what was good, what was honorable, what was excellent in this community. And there is so much richness, and so much of that excellence in this community. And that's we are committed to bringing you the good, the bad, the ugly, but the wonderful. And if you have something that you feel is wonderful, a press release about an accomplishment or an achievement, yourself or your child or your neighbor, or something that you feel tells the tale of Franklin Township, let's make us all proud. Let's be the community that we think we are, and talk about what's wonderful. We listen to what's not wonderful, but let's make sure that the wonderful is what we focus on, because we deserve happy. We deserve acknowledgement. We deserve the excellence that we create. So, and I have a very vocal little puppy who's accenting every single thing that I say right now. It must be a squirrel.
All right,
Or
Frank,
leaf.
we're
Cody. Oh, Cody, you're going to be
there
famous,
must be a leaf
baby.
outside the house. This edition of the Franklin Advocate News Hour for January 13, 2021. And so much for tuning in, and we will see you tomorrow. Tomorrow at 7 o'clock.
Tomorrow at 7.
And that promises to be another informative and interesting program. So, as usual, Franklin, until we see you again, stay safe. DJ, say that thing that you say.
And we will be back.